I have a phrase, I say we're a modern approach to patient care. And all that really means to me is that we're just trying to do the best for our patients all the time. It just means we're looking for ways to keep refining what we're doing. And so we're looking for the simplest way to get things done for patients. So for example, for dental implants, we know that's the simplest way to replace someone's missing teeth. And we know it's the best way for that matter too. But ultimately we look and say, how do we do it in such a way that makes it easy for that person to do? Well, what we find out is just finding out any insurance or any financial costs up front so that person knows what their expectations are before we start. Making sure we're doing the procedure with minimally invasive incisions so they don't swell up that much at all and have a very simple recovery. We're able to perform this x-ray on that person, and we're able to look at the jaw in 3 dimensions to see how thick the bone is, how tall it is, how wide it is, and determine if we can replace that tooth with an implant based upon how much residual bone is there. But really what we're saying is we innovate and we change things. We're constantly every day figuring out how to make this easy, and it really makes a difference. It really shows. First and foremost, we are a patient-centered practice. We look at that person, we get to know them, and we try to help look out for them and help them make a good decision for what their needs are.
It's just really pleasant. The people here act as though they've been my friends for a long time, but over 10 years they have become friends.
When somebody comes to my office nervous and afraid, the first thing I say is, you're in the right place. We're gonna help you overcome those fears. We're gonna help you show you how much easier it is in this office and dentistry is today than it ever has been.
I didn't know what an implant was all about, and Dr. Collins kind of explained it all, and it's relieved a lot of my tension about it.
He had a way of really relaxing me, and I've been with him ever since.
At the end of the day, what we want patients to feel is comfortable about their decisions, glad they came to see us, and just know that we care about them.